Elizabeth O'Donnell was overjoyed to find out she was pregnant in June of 2020. She says the cherry on top was knowing she and her husband were about to have a little girl. They had chosen the name Aaliyah and looked forward to being first-time parents. But when O'Donnell reached 31 weeks, her pregnancy took a turn for the worst.
I had a perfectly textbook pregnancy up until November 28th, 2020, right after Thanksgiving. I hadn't felt Aaliyah move much that day. And I contacted my doula thinking that I was just a worrisome first-time mom. She encouraged me to reach out to my hospital. So I went in, and that's when I found out that Aaliyah no longer had a heartbeat.
That day, Aaliyah was born still, and O'Donnell's world came crashing down all at once.
I felt fine. I felt good. And then to just hear that your child has died I went instantly numb, is the only way I can explain it.
The CDC reports that stillbirths affect about 21,000 babies each year in the U.S. Though there's continued to be a downward trend since the 1940s, the decline has slowed quite a bit in recent years. Thousands of mothers like O'Donnell are forced to walk out of a hospital alone, going home to an empty nursery.
How did I go from this perfect pregnancy where life was so blissful to my world ending? Leaving the hospital, seeing people come in. There's no back door for you to leave after you experience this. Seeing people walk in labor, walking out with a baby, and you're just walking out alone is quite possibly the most isolating experience one can have.
In the beginning, O'Donnell says she didn't want to speak to anyone. Instead, her family and friends sent over self-care items like candles and tea. O'Donnell set a goal to use one item each day, even when she felt as though she didn't deserve it. As O'Donnell worked through her grief, she realized that the care she'd received from her friends and family should be available to everyone. So from her own experience of loss and pain, she created Aaliyah in Action, a nonprofit organization that helps other women in similar situations.
We provide self-care packages to families after they've experienced any form of pregnancy or infant loss. I experienced a stillbirth, but we know that there are multiple forms of loss in this space. And I did not want to discriminate with this program because all of this loss hurts. It has a profound mental toll on us, physical toll, and we all deserve a bit of healing, a package to help with that grief journey. None of what's in this package is meant to make you feel better. It's just supposed to make you feel something at a time when you feel numb and you don't feel worthy.
These packages include 6 self-care items that range from lavender candles to fuzzy socks. O'Donnell also includes a self-care choice board that she's created to encourage women to do one action each day. Sometimes that means taking a hot shower, and other days it's saying your baby's name out loud. All of the products are hand-selected, and O'Donnell honors her own daughter with each package.
These products are not donated to us. One of our values is to purchase them from women in Black-owned businesses because that's who Aaliyah would have been. They're the people we purchase from. It's just a reflection of who our daughter would have been.
The care packages are distributed through hospital partnerships because O'Donnell wants families to have them right away.
For hospital staff to provide you with this package, it's not a gift. I think receiving it after, it can kind of maybe feel like a gift and you feel like, oh, I don't deserve this. But when it's given to you by the hospital, the idea is that you have permission to take care of yourself. You are the individual that needs to get to tomorrow, and it's going to be really hard. And so if snuggling up on your couch with a cup of tea and a face mask on helps get you to tomorrow, then let's do it.
Through Aaliyah in Action, O'Donnell's been able to affect lives both individually and on a larger scale. She's sat with legislators to help increase awareness of stillbirth prevention and supports 2 pieces of current legislation. The first is called the Maternal and Child Health Stillbirth Prevention Act of 2022. It adds the terms stillbirth and stillbirth prevention to Title V of the Social Security Act, a grant aimed at promoting the health of mothers and children.
So a lot of states don't realize that they can use this funding on stillbirth prevention programs because the word is nowhere to be found. It covers childhood cancer. It covers a lot of other things that we just think of, oh, of course, federal funding would go towards these things. And yet the word stillbirth is nowhere to be found. And so that act would simply add stillbirth and stillbirth prevention in the Title V funding so that states know that they can use those funds towards stillbirth prevention methods like Count the Kicks and any others that are out there.
Count the Kicks is a campaign created by the nonprofit Healthy Birth Day. 5 women from Iowa started the organization after experiencing their own stillbirths. They discovered that many stillbirths are preventable and were determined to help other mothers save their babies. They consulted Dr. Neil Monsager, a maternal and fetal medicine physician.
There was a study that had just come out about that time from Norway that showed the benefit of moms tracking their own baby's movements. And that study showed an ability to decrease the incidence of stillbirth if moms were tracking baby movements. So they then came back to me at some point and asked me what I thought about that. And I agreed. I mean, it just makes common sense. One of the ways we monitor fetal well-being is with ultrasound, and we're primarily looking at various fetal movements with ultrasound. So it only makes sense that if mother is also monitoring fetal movements, that she might be able to pick up on something before we would actually be able to identify it in the office.
The team created informative brochures that they distributed around Iowa, encouraging women to begin monitoring their baby's movements at the beginning of the 3rd trimester.
I believe it was within the first 5 years after they began this campaign, Iowa started to see a decrease in our incidence of stillbirth. We didn't make any other changes from a healthcare standpoint. The only change that was made was this advocacy campaign by Count the Kicks. So I can't say 100% that their efforts are the reason that the stillbirth rate dropped, but that lower rate has been sustained over the years since they've been active here in Iowa. So I'm a firm believer that indeed the work of Count the Kicks is making a difference.
The nonprofit reports that Iowa's stillbirth rate decreased by 32% in the first 10 years of the Count the Kicks campaign. Monsager, who's now the medical advisor for the organization, saw firsthand how the Count the Kicks smartphone app can save lives. One night, a patient came in complaining that her baby wasn't moving as much as usual.
I read the ultrasound the following morning, but by that time, mom had already been delivered because the heart rate tracing that they had that night was quite concerning. And baby Rose became somewhat famous because this was really the first time that an app monitoring fetal movements had actually made a difference and actually saved a child's life.
Proving that some stillbirths can be prevented. Unfortunately, many mothers still don't have the proper information. To fix this, a second piece of legislation has been introduced, called the Shine for Autumn Act of 2022. If passed, it will be the first federally funded stillbirth legislation, putting money towards research and education. O'Donnell says the information is for both families and doctors.
We have a lot of misunderstanding around stillbirth in the medical community. So, for example, we were not given a reason for Aaliyah's passing. In the beginning, we were told she was fine. Everything looked fine. We were actually kind of discouraged from doing an autopsy because literally, this is the only way I can say it, everything was so fine, except she wasn't breathing.
It wasn't until O'Donnell had a placental pathology done by a doctor at Yale that they discovered the true reason behind Aaliyah's death. Even though her daughter had been fine, the placenta had failed, cutting off her oxygen.
If I didn't have this extra testing done, we would not have known that. And I would be in mental anguish all the time, thinking the next time I get pregnant, is this going to happen again if everything was so fine? And now all of a sudden it's not. And I do not mean any disrespect to the doctors that I had, because I really did love them, but they just didn't know. And when I'm thinking that I'm going to some of the best doctors in Washington, D.C., and they just don't know about this, that's not good.
O'Donnell admits that before her own experience, she had never heard of stillbirth. The only discussion she had had with her doctor was that as long as you felt movement, everything was fine. Monsager says conversations around stillbirth didn't used to be a consistent message between physicians and patients. Now, many moms are made aware that they should notice all movement, especially decreased movement.
So we ask moms again to, on a daily basis, to monitor baby's movements, whether that's sitting down and actually counting them out, 1, 2, 3, 4, etc., or whether it's just a general acknowledgement of, okay, as I was brushing my teeth today, this kid was moving all over the place. So we have some criteria, some kind of minimum criteria. So 10 movements in an hour. But mainly what we're looking for is for moms to be able to know what their normal activity level is for their baby and to know whether that has changed.
Monsager says this type of tracking can save your baby's life, which is exactly the message the SHINE Act aims to promote. O'Donnell says the time is long overdue for stillbirth prevention to be a public conversation.
I think a lot of mothers, especially mothers that have experienced this years ago, are so tired of seeing new moms like me going through the same things that they did, and nothing has changed and nothing is fixed and people are still not educated. The Shine for Autumn Act would really bring to light this silent issue that people just really haven't been focused on. And from what I have seen, are also just scared to talk about because it's just so sad. But what's even more sad is that it's 2022 in the United States of America, and we have an alarming rate of stillbirths compared to other countries that are similar to us with similar economies. It's shameful. And now's the time for us to try to fix it a bit.
If you're interested in receiving or sending a care package or donating to O'Donnell's organization, visit aaliyahinaction.org. You can find more information about stillbirths, Count the Kicks, Elizabeth O'Donnell, and Dr. Neil Monsager on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. This segment originally aired in October of 2022. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.